I work with Dr. Tojo Tejinpuri and Ann Washington. They're both professors there. And we work on healthcare reform policies. I'm interested in healthcare reform in the U.S., purely domestic policies. And just in 2009, Obamacare, or Affordable Care Act, was passed. It has now become a law. Many people don't know it went through many processes of revision. And there were repeals that were placed by many organizations. Some of the organizations stated that there were certain things about Obamacare that they were not in favor of. And one such organization is the NFIB. The NFIB is the National Federation of Independent Businesses, and it represents the interests of small businesses. So it's looking at the concerns of the small businesses. They did have a fairly negative viewpoint toward the healthcare reform law, which is now a law, the act back then. And so I analyzed why the healthcare reform was looked at negatively by the NFIB and what these concerns are to the small businesses in the U.S. So I took the study. It is actually primary research. I looked at the Supreme Court hearings. There were about 100 pages of the actual hearings of the repeal. The repeal process involved two stages. So the first part of the repeal process was the NFIB's viewpoints on why healthcare reform is not going to help the small businesses. Then there was a rebuke or a rebuttal process where the amicus curiae, which is the friend of the court brief, that process involves other organizations that discuss why they think the Healthcare Reform Act is in favor or will actually help other organizations. So this amicus curiae brief was done by various healthcare organizations such as the AMA, American Medical Association, ACA, American Cancer, ACS, American Cancer Society, and others. But I focus the primary focus of my project is on the NFIB. So I'll come to the review point, but start off with the NFIB. So my main agenda for today, I used three main steps in my case study. I started off with a content analysis, so I looked for the four major concerns that were raised by the hearings. So I looked at these four concerns. Changes to Medicare and Medicaid, that's one of the major extensions of healthcare reform. They're looking at trying to expand. Medicare is the senior citizens health insurance program. And Medicaid is the health insurance program for disadvantaged individuals. And through healthcare reform, they're actually going to expand these processes, and they will be paid by the taxpayer. So that's one of the that's something that's a little bit controversial, but it's being expanded. Second major provision I looked at was community rating and guarantee issue. This is nothing but trying to promote the lack of discrimination. So before, in the pre-healthcare reform stage, there was a lot of discrimination against individuals with comorbidities. So if they have cancer, obesity, and other conditions, all at a stretch, they were not being provided health insurance. So these measures in the new healthcare reform law are actually going to prevent against discrimination against individuals with comorbidities, pre-existing conditions, and those kind of issues that they might have with their health status. The third thing I looked at was the individual mandate. This is one of the most controversial parts of the law. That's because they are requiring every individual in the U.S., regardless of income, regardless of demographic status, to have health insurance coverage. So that is the single most controversial part of the entire law. Finally, I looked at financial issues. This is, of course, a great concern for small businesses. They're worried that, especially an organization that has less than 10 individuals is very worried about having to pay for every single employee's health insurance policy. So because of that, I looked at some of the good aspects as well, like tax credits. Through healthcare reform, they're providing tax credits to employers to be able to fund the employee health insurance. So those were the four main categories I looked at. I'll be talking about a statistical analysis I did. Based on the categories, I looked at whether the NFIB portrays these categories as either positive or negative. And so this is actually done as a logistic regression analysis. I took the dependent variable, which is the positive or negative attitude, and that was based on these four categories. And finally, I'll be talking about a more thematic analysis, which is how are these provisions backed up by a philosophy? So what are the main philosophies in American history or even in, in international history that could actually provide evidence for these different categories and for the attitudes that were so negative toward healthcare reform? So the major theories that I came across are public choice model. This was suggested by Kingdon, and he talks about how for healthcare reform to really develop as a major subject, he talks about it having to come into the policy window, and this is quote unquote policy window is his term that he is saying. And it's very interesting because he says that small businesses and organizations have to be very proactive. They have to know that healthcare reform is a important and prolonged. It's going to come in phases. So people have to be ready. Employees and employers have to be ready for this change. So he basically talks about that theory. Then I looked at the role of government. This is, of course, age-old problem is expansionary government versus a more limited government. And so Adam Smith, you have the invisible hand, you have laissez-faire policies, let the markets run wild, let them do what they want. That's his body of thought. Then you have Keynesian philosophy. Keynesian philosophy talks about the importance of economic expansion, the importance of the government being involved in public programs. So that was another philosophy. The third one, American exceptionalism. This is the concept that I think Roger Stout talked about it yesterday a little bit. Concept of checks and balances that Americans have always had their system done differently, and now we're moving toward policy of universal health care, which is very much like other OECD countries in Europe and other places. So as you can see, Americans might even be moving away from this American exceptionalism, or it could be thought of that the new healthcare reform law is going to move more toward American exceptionalism based on how they're going to run their healthcare system. So all of these can be looked at from different viewpoints, and that's why I'm providing these two sides. Finally, internal versus external locus of control. What this is, this was a theory brought up by Julian Rotter, and he talks about how an internal locus of control is where individuals in a country think that they are responsible for their own actions. So, for example, in healthcare, it would concern, especially in the pre-healthcare reform time period, all Americans were supposed to support themselves. They're supposed to have health insurance. And I think that's the way of life. So they don't have to have it, but it would be good if they have a certain type of health insurance plan. On the other side, external locus of control, it works toward individuals who depend on the government. So they're depending on the government to provide health insurance. So you have the two different logic structures. And then you have the American individualism and liberties. This is, again, an important concept because how much should the government be intervening and how much should individuals have the right to choose their own health insurance plan? So these are the different philosophies. I'll talk a little bit more about how I incorporated the statistical model and how I incorporated the philosophy. So now with the statistics, what I did, I took those four individual provisions that I had at the beginning: Medicare, Medicaid, community rating, individual mandate, and tax credits. These are the four major policies and four major provisions in the healthcare reform law. And I took tax credits and financial issues as a base category. So the other two that were statistically significant, the other two provisions, are being compared to this base category of financial issues. And I found that using an odds ratio, that community rating and individual mandate were actually less likely to have a positive attitude toward healthcare reform than financial issues. So financial issues were looked at fairly positively for healthcare reform, but this individual mandate, the fact that people have to be required to have health insurance, was a big negative. It's a big no-no. And same thing for community rating. The idea that we're going to take away discrimination or that employers have to provide health insurance to all employees was, again, a little bit controversial. So both of these proved to be statistically significant, and they were negative attitudes in healthcare. So then what I did to incorporate philosophy and the statistical model is I started off with finding various provisions in the Supreme Court hearing. So I would quote the exact provision or the exact statement. Then I moved forward to analyze whether it was a positive statement or a negative statement. So what was the attitude? And then finally, I did an interpretation of my own and used those different philosophies I talked about. So the public choice model, the role of government, American exceptionalism, locus of control, and American individualism, And I tried to use one of those to support my finding. So if there was a positive attitude towards the exchanges, the health insurance exchanges, one of the statements was that the health insurance exchanges are actually a cost saver. So I thought that as a positive attitude. I said that this means that exchanges can actually cut costs. And then I used the American exceptionalism principle to support the fact that by cutting costs, you're able to provide checks and balances. You're able to balance the healthcare system, and in that way you can prevent any kind of crisis that could develop later on. So in that manner, I've actually gone through many statements. In the appendix of the paper, I have the entire list of all the statements I analyzed. And that way I've created the negative and positive viewpoint. Now, also keep in mind that this viewpoint is the NFIB. So now I'm going to talk about the rebuttal, or the other viewpoint, which is positive. This has been primarily negative viewpoints toward healthcare reform. So now the opposing viewpoint. This was done, like I said, it's a friend of the court brief. That means that it's done as a rebuttal brief. And I did the exact same thing. For example, they quoted that for people below 200% of the poverty line, the subsidy will cover 80%, which makes it attractive for individuals to join. So this is, of course, a positive viewpoint. They're showing that more of society will be covered by if everybody has health insurance. And it actually helps those in the greatest need through dependence on public policy programs. So I saw this as an external locus of control, because individuals are requiring the government to provide health care and are depending on the government. So it's that external locus of control concept. And in this process, I've done the same thing for other quotes, and I can go over it maybe if I have more time at the end. So then I did an overall count of the themes. I found that government's role was mentioned the most, about 16 times throughout all the hearings. And in terms of a comparison of negative and positive, I saw that the government's role was mentioned 11 times negatively. On the other hand, it was mentioned 5 times positively. Now, keep in mind that this is the idea of content analysis. You're looking at how many times something was measured negatively and positively, and then comparing and seeing why this could be. On the other hand, you have other statements such as internal external locus of control that was measured 4 times positively, but only mentioned 3 times negatively. So something like that is less controversial, and it's actually seen as in the positive light for healthcare reform. And the other counts, you can see public choice model mentioned only 5 times. Maybe that's not a big focus of healthcare reform. Internal external locus control, overall it's mentioned 7 times. American exceptionalism was mentioned 7 times. Liberties and individualism mentioned 6 times, which is pretty surprising because Americans do have a big focus on this individualism and concept of individual liberties. And so in conclusion, I found that government regulation was the biggest concern for individuals, for small businesses who were trying to support the concept of healthcare and healthcare reform. And it may be time to adopt a new way of thinking. Maybe it's time for us to be more open to an external locus of control, more open to public choice theory, and maybe American exceptionalism is changing because of looking at these findings. You can see that American exceptionalism may not just be about checks and balances, it may also be incorporating other philosophies. And this is a great way to see how attitudes are impacted by healthcare reform. And overall, I saw that some of these issues that were recurring, such as adverse selection, can be some of the greatest hindrances because small businesses don't have the proper information. It could be possible that they're being stifled by the lack of information that they're receiving on these major measures. So some of the policy recommendations I would provide is that to be able to provide small businesses with more information on the policies, how they're going to be impacted. They seem to be perfectly well immersed in the financial aspects. They know they're going to get certain tax credits or get certain tax policies in hand, but there may be other factors that they don't know too much about, and that's probably why there's such negativity toward healthcare reform. That's it.
I think you have proved why Obama used to say the change we need.
Change.
Because the government's regulation and intervention have been found to be very negative. So any questions from the audience? Yes, please. related to healthcare, I'm sure we are all looking for.
No?
From my side, I think no question as